Hi, and welcome to this edition of Healthline. I'm Dr. Kevin Soden. We all want the best deal for our money, and that includes medical treatment. So if you could get top-notch surgery for a fraction of the cost, would you take it? There's a catch. The operation is performed in another nation. The concept is called medical tourism, and it's gaining in popularity.
When it comes to astronomical medical costs, you can see why Americans are jetting off to Western-style hospitals in exotic locales like India. The frenetic streets of Mumbai offer a vivid contrast to the Finger Lakes region of New York State, about 4 hours west of Manhattan. It's rich in wine and vistas. Ken Priggen and his wife PJ moved here a year ago to enjoy endless dog walks, kayak trips, and gardening. Together, they built their dream house.
Well, the stone came from this area. It's something I enjoy doing, except it's a little tough with the up and down on the hip. So I'm hoping to do more once I, get a little bit better.
But months of sweat and elbow grease took its toll on Ken. Leg pain slowed his life down to a limp. Doctors diagnosed a severely arthritic hip.
It's livable, but I can't live this way. I need to do something. I mean, walking is not overrated.
But it's been this way for a while. I mean, it just breaks my heart to watch.
Ken's doctor recommended a total hip replacement. Pretty routine stuff these days, like buying a new set of tires. So Ken got busy online doing research. On TotalJoint.com, he discovered an alarming fact. Total hip replacements last only 10 to 15 years. At 57, Ken would need a second hip surgery, maybe even a third. And with each revision, the risk of complication increases. Ken shopped for an alternative and soon found it. Hip resurfacing, a less radical approach that is revised more easily down the road. Unfortunately, hip resurfacing was only approved in the U.S. in 2006. Few hospitals offer it, and insurance would not cover it. But Ken suspected that hip resurfacing might be right for him.
It preserves more bone, so it's not as drastic of an operation, and it provides an easier revision if something else happens down the line.
Then Ken found his Top Gun surgeon, a surgeon who worked with the British inventors of hip resurfacing 12 years ago. He has done over 600 procedures, but there was just one drawback. Dr. Malhan was 8,000 miles away in India. This former engineer and rocket scientist had made up his mind. 3 months after contacting Top Gun surgeon, Ken said goodbye to Scruffy and PJ and set out on an adventure. Ken drove to Rochester, flew to New York City, then across the ocean to Paris, and finally on to Bombay, now known as Mumbai.
I feel stiff after 23 hours of hard traveling.
In 2006, nearly 3,000 Americans and Europeans came to India in search of low prices, faster service, and procedures not readily available in the West. Take a look at a comparison shopping list. In the U.S., these are the approximate prices for heart bypass, back fusion, and hip replacement. In India, these same surgeries cost anywhere from 50 to 80% less. This does not include plane fare.
The quote that I got for the procedure, the package price is $7,500. Travel, figure another $1,500 to get over to India and back.
Ken was getting the surgery he wanted at half the price, performed by a highly experienced surgeon. First world healthcare at third world prices. Hospital staff get down to business. Day one includes x-rays, blood tests, and heart monitoring.
Now I'm just waiting to get it over with.
Ken is tired of waiting, tired of worrying. No matter how much he trusts Dr. there are always risks. After all, this is his first surgery, and he's 8,000 miles from home, a world apart from loved ones. Ken Priggen of Hammondsport, New York, loves to build things, and so does his surgeon in India. Dr. resurfacing the ball joint on Ken's hip. Many feel this alternative to total hip replacement is better for younger patients and provides greater mobility. India, a nation of 1 billion plus people, is exploding with modernization. The momentum is palpable. They seem to have it all here: an advanced ICU, well-equipped physical therapy, the latest in MRI and CAT scan imaging, and an emergency room that tracks all their ambulances in real time with GPS technology. For Dennis Richards from Ormond Beach, Florida, the toughest part was convincing family and friends that he'd made the right decision. Damon Richards accompanied his dad to India. They toured the Taj Mahal together before settling into their luxurious suite. Dad got 2 new knees, while son got 23 shiny new teeth and a jaw realignment to prevent grinding.
Not only was the doctor very good at what she did, I had sent her credentials and some of her things to some of the people I know that are dentists back home, and they were impressed by them. So not only was she, fully qualified, she had great bedside manner, but at the same time, it was done quickly.
For 2 new knees, 2 extra weeks of physical therapy, 23 crowns, and 2 round-trip airfares, one-way first class, total bill was $23,000. Compare that to more than $100,000 back home. 2 days after surgery, Ken is learning to walk again. Another patient down the hall from Ken in the Amethyst Suite is Linda Evans from Wenatchee, Washington. She says her hip surgery was rejected by her insurance as a pre-existing condition. She felt like she didn't have a choice.
If it comes down to you, your life, and the wheelchair, what are you going to choose?
Don Russell just arrived from Orange County, California. At 83, he can't bear to be away from his work, remodeling houses. So he's here, hoping for a resurfaced hip like Ken.
I have contacted a surgeon that would do the resurfacing, but my health provider would not go for it. They said, no, you do our way or no way. I said, hey, I'm off to India. You're making me so happy.
Okay.
You make me so happy.
Okay.
8 to 10 days after surgery, Ken will begin the arduous trip back home. Ken has Dr. Reck's cell phone number and email address. If it becomes serious, Ken will eat some crow and visit his local doctors.
I haven't been disappointed. I haven't been elated. Oh my God, except, it's sort of like, waking up was always nice.
Well, I'm going to tell the world. I'm going to let the world know that we have options.
With healing well underway and plenty of physical therapy, Ken is back home along the Finger Lakes of New York State, finishing their house and taking long dog walks.